Assalamu alaikum. Jazakallah khair. I really feel honored and humbled and for IPDC for giving me the opportunity to talk about COVID vaccination. And more so, I am pleased that it is followed my beloved teacher, Sheikh Ibrahim Danoon, who is my Aqidah teacher at Ummah. So I really feel honored from that point of view. And the topic was discussed amazing. And this is one of the most difficult topics though you struggle. And this is a good timing to talk about this topic. So Bismillah, I'll start from just having some open disclosure. And this is that I like to talk about COVID vaccine. I like to clear that, I am COVID vaccinated. So I'm not giving you an advice or talk that I don't follow. So I follow my prophetic sunnah, inshallah. And also I have no relationship or linkage with government COVID vaccine committee or any pharmaceutical industry, just as a conflict of interest. However, I work for NSW Health Government primarily as a clinician dealing with the COVID patient hospital and being hospitalized. On the right side of the slide, as you all can see, this is going to be a new passport. It's going to be COVID passport or COVID digital certificate. Those who have been vaccinated already can see this, can download it from the health government website and can keep it in your wallet in the iPhones or any other digital format version. And this is going to be your next, future travel, your work, your schooling, etc., an essential need for you to show. Now, let's just start from the, types of COVID vaccination. And I don't like to be teaching you guys science, but I think it's all fundamental. And we come to the point now that probably it is time for us to learn a bit of science, regardless our educational background. So now there are multiple, more than 500 or even more vaccines have been already in the pipeline and more to come. All right. However, the 3 vaccines that have been approved by TGA, the Australian authority, is the AstraZeneca, Pfizer, and just recently Moderna vaccine. The vaccine I'm going to briefly talk. So the primarily in Australia, got the Pfizer and AstraZeneca. As you all know, that Pfizer is a little bit short of supply because we can't locally produce Pfizer. And this is because it is a technology, a new technology of vaccine is a miracle in the era of vaccination. And hence, there is shortage. It has to be imported. And hopefully in future, it takes a year or so to have this kind of laboratory setup locally. So we might have that in future, in a couple of years' time, this local production. But at this point, no. And that's why it is short of supply because of the issue of the import and global demand. The other one is AstraZeneca, which is locally available, and also, it is locally produced. And the Moderna just have been, approved, and we, Australian government has secured 25 million Moderna vaccine. Hopefully, it will be available from end of September onward. By the end of the year, it should be readily, easily available. Now, the vaccines that we got 3 different types, actually two major scientific types. So one is called mRNA. I'm just talking more for your youth that who be interested to know a bit of science. So one is the mRNA, it's called messenger RNA, which is basically the beauty. The way it does work, that basically the target for the vaccine is the corona of the COVID virus. Corona is that, the spike. So basically the mRNA is a code. A lot of you guys do the coding or the computer coding, etc. So it is a protein coding. So basically, this messenger RNA is a nanoparticle that gets injected in your body, which carries a message or coding for that corona or that spike protein or the COVID virus. Once it goes into your cell, which is the factory, it starts to produce the protein, the spike protein, as it has been messaged or coded. And that spike protein goes into your bloodstream. And then your body recognizes this protein as a foreign protein or coronavirus and try to produce immunity against it. And that's how you get the immunity. And Moderna is the same mechanism, all right? And then comes AstraZeneca, which is a different way. How does it work? it's a viral vector where the virus is collected from the chimpanzee, which is called the adenovirus. It is weakened or modified. It is kind of dead virus. In that virus, they put a DNA coding for that spike protein. They inject that dead virus with that coding into your body. Once it goes into your body, it goes into your cell and it produces the protein, the spike protein, and your body targets that protein, and that's your immunity. So that's as very simplified scientific explanation for all those vaccines that we are talking about today. Has to be 2 doses. So Pfizer, you take at least 3 weeks apart, and for AstraZeneca, you take at least 4 weeks apart. And after those both shots, another 2 to 3 weeks to have your full maximal immunity to be developed. Now, what about the vaccine effectiveness? And this is important to know, all of us, because a lot of talks, what's the point? We can get the infection. Is there any point? I'm taking the vaccine. I'm seeing people getting infection. Despite in Bangladesh, you see a lot of people are vaccinated and they are getting infection. Now, we need to understand a little bit of what we are talking about the vaccine effectiveness. At this point in time, COVID is a difficult virus to handle with. It got multiple variant, mutation, all these hassles. And we are not talking about to completely eradicate the virus from the world, okay? We are talking about to reduce the deaths, to reduce the people recurring hospitalization, all right? You might still get COVID infection despite having the virus. Your chance would be less, but it's not 100% protected. But more importantly, even though you do have a COVID vaccine, it will be just like a simple virus, like flu, okay? It will prevent you not to be too sick that you need to be hospitalized. And that is the goal, scientific goal for the vaccine campaign. Now, as we can see that both Pfizer and AstraZeneca nicely showing in the studies that it reduces the hospitalization, ICU admission, and mortality close to 90%. So for a vaccine, for a treatment intervention, as a doctor, I can say, this is a great vaccine to be utilized. Now, let's talk about the risk and benefit, okay? So now let's go to look, we like the data. Doctor, you're talking about all those things, but what is the evidence? Have you got a data? There's only talking about the data that was published, the journals, that was, pre-marketing data, like before the experimental data, but real world data. Now, this is the real world data I'm going to talk about. Before I go into the data, I'd like to show you that what is the risk, what we are concerned, all right? Now, on the right-hand side, let's talk about the right-hand side data. That blood clot we're talking about, all right? It is so far in Australia. I'm not talking about the world, the global data. I'm talking about the Australian data. So far, the Australian data showing that out of 8.1 million of AstraZeneca vaccine, we had only 112 cases of blood clot, which is quite low. It's even past in a 0.000 something. And as long as you are worried about death from the vaccine, because we had deaths like that, only 6 out of 8.1 million AstraZeneca vaccine, which means that 1 case per 1 million. All right? And for us, we express our condolence to those families because they are the young ones. But this is definitely negligible, a minimal, and there's no medication, no treatment that doesn't come with a side effect. All right? Every medical intervention has some sort of issue. A lot of people can get allergic, severe allergic reaction, even for an influenza vaccine. All right. So it is a negligible amount of blood, number of blood clot, and mortality is much less. That's 1 per 1 million. As long as the Pfizer concerned, there are only 188 reports of suspected inflammation of your heart, which is called myocarditis or pericarditis, out of 7.2 million. Or once again, it is a negligible number. And also, out of those patients, only very small number was requiring hospitalization, some treatment, no death whatsoever. Number one. Number two, they were suspected. They might get some chest pain. They did some blood testing. They saw might have some, inflammation of the heart from the Pfizer, but that was not confirmed. So it is even very negligible. So there's no major concern, all right, apart from the blood clot that caused 6 mortality as of today. Now, on the left-hand side, look at the left-hand side data, that how many COVID cases we had so far. We had 41,000. And how many people have lost so far? We have lost almost 1,000. So we are talking about, that blood clot mortality, 1 case per 1 million, as opposed to we lost 1,000 out of 40,000 COVID infection. If you calculate as a percentage, it will be 3%. So out of 100, 3 people died from COVID infection. So this is a much, much big difference in terms of the mortality and showing how bad the COVID infection can be. Now, secondly, people talk about, some are coming and talking, oh, blood clot, doctor, this AstraZeneca, I'm not very comfortable. Why? Because it can cause blood clot. Give me some simple data. A lot of people smoke. Okay, if you do smoke, hopefully not in our IPDC rather, but just as a general. So your chance of having a blood clot 0.18%. All right. And some of the females take birth control pill, like the contraceptive pill, we call it. And the chance of blood clot from those contraceptive pill can be as high as 0.12%. But AstraZeneca vaccine, the chance of getting a blood clot is 4 cases per 1 million, which is 0.0004%. It's very low, it's negligible. All right. But then if you do get COVID infection, your chance of having a blood clot would be 16.5%. So we're talking about having a blood clot, the vaccine is 0.0004%, as opposed to from the COVID itself would be 16.5%. So it's a big difference, as you can see. Now, does the vaccine work? What is the data from locally? Because Australia, our population is small, our vaccine campaign was not great. We're just learning things. But look, this is the latest data up to 7th of August that I can show you from New South Wales. Okay, so what it's showing clearly, people who have been fully vaccinated, we had 0 of them requiring ICU admission, and people who got fully vaccinated, only 2% ending up in hospital, as opposed to people who are not vaccinated, they are 91% in ICU admission. So what I'm trying to say, that people are fully vaccinated, only of 2% of that cohort regarding hospitalization, as opposed to people who are not vaccinated at all. Their chance of going to ICU or hospital was around 90%. So definitely it's showing that vaccine does work under the mercy of Allah subhanahu wa ta'ala. Now, look what's happening, and we need to know these things. And I like to encourage our brothers to know a bit of data, because then you'll feel a little bit reassured, So the vaccine rollout up until 18th of August 2021 data, you can see that, we have been lagged behind. If you look at the data, Australia was very much lagged behind, in terms of vaccination. Maltese has got 92% vaccination. Israel got 80% plus vaccination rate. Australia, as of today, and when I said 92% vaccination of Maltese is both doses. Australia, as of today, we achieved first dose vaccination 50%. All right, and we have achieved 28.2% of both doses of vaccination. So we are moving forward, and we probably behind, but government has taken all these escalation of this campaign to make it a success. And inshallah, in coming days, we have a plan in place, and I will talk about it later, that inshallah we would get to the target. What we are targeting now, so our target eligible population that needs to be vaccinated is 20.6 million, who are 16 plus. In Australia, currently not providing vaccine to anyone below 16 years old, which means that high school, earliest year 7, year 8 would not be qualified as of today. Now, if that 20.6 million, we have got almost 50.24%, but our target to achieve the 80% vaccination as soon as possible. That is the landmark for achievement for us to move forward. Now I'm going to just a little bit talk about the spiritual aspect of this COVID-19. And here I like to highlight Brother Ibrahim Danudun's presentation. Yes, Al-Qadr. So Al-Qadr or Al-Qadr, So Al-Qaeda, COVID-19 was Al-Qaeda.
Join the meeting.
COVID-19 was Al-Qaeda, that 2019 December, Wuhan city will get a virus from a bat, whatever it is, and that's going to change the landscape of the entire world. Okay, that was the Al-Qaeda. And then it all comes on and it changes everything. And now we are talking about Al-Qaeda. So now we're going to, how it's going to implement, and we've already seen how it's going to implement it. One question that I encountered from different brothers working with my Lebanese Muslim Association, different that, brother, it is our qadar. What you bothered about vaccine? Allah gives it to us, Allah will take it off. Just rely on Allah, Allah subhanahu wa ta'ala, tawakkal on Allah. Don't worry about, don't talk about vaccine. Brother, for the God said. And I like to explain here that you might get encounter this question, and a lot of you might have this similar sort of thought process as well. Look, as Sheikh was nicely explained, that yes, it is Al-Qadar. Destiny comes from Allah, undoubtedly. But at the same time, we have to understand that we have to do our part. If we don't do that, that's not right. Just remember this hadith that, you have to tie the camel and then rely on Allah. So we are not changing our destiny, but what we are doing, that is under the discretion from Allah subhanahu wa ta'ala. This vaccine is definitely at the qadar of Allah subhanahu wa ta'ala. It's not something that human created without the mercy of Allah subhanahu wa ta'ala. Now the question is there a light at the end of the tunnel? And I recite this surah, the Surah Al-Imran 139, as Allah subhanahu wa ta'ala said, وَلَا تَهِنُوا وَلَا تَحْزَنُوا وَأَنْتُمُ الْأَعْلَوْنَ إِن كُنْتُمْ مُؤْمِنِينَ. So atumra nirash hoyo na, and don't be hopeless, and don't be sad. If you are a believer, definitely you will win. And inshallah, we will win. Again, not just with COVID-19, but as a whole, as ummah, we win. And I like to add one thing here. Like a lot of, distress, sadness, despair, and helplessness, hopelessness. But last week, when I was watching the news and when I see the people of Afghanistan, there's a lot of, that were entering the capital of the country with the white flag of La ilaha illallah Muhammad Rasulullah. And at the same time, I was watching the live Al Jazeera, seeing those disbelievers who tortured them, who humiliated them for 20 years. They're fleeing like ants, and they are lifted. This might be political, but this is our belief. If we are in the right path, inshallah, we would win, and there's nothing for us to be hopeless or helpless. Inshallah, Allah would look after us. Now, so what about the light? What about the light of the COVID vaccine issue? Now, I'm going to just briefly talk. So the target for us is 80%. And you can see that target of 80% is calling consolidation phase. And what does it mean? So when we achieve 70% vaccination, that is called transition phase. So there's a phase B. The government planning, at 70% landmark, the lockdown will slowly eased off. I can tell you all of you one thing, that this lockdown is not going to go away, no matter what we're doing now, until the vaccination target achieved. So once we got the 70%, inshallah, then the slowly lockdown will started to withhold, and then the border will start to open up. But more importantly, by the time we get to the 80% vaccination target, which is called consolidation phase, we would be getting probably close to our liberty of life that we had early few months back or early this year. Pretty much, very specific lockdown. Every schools will go back onto that. Work will go back onto that. As long as you're vaccinated, you'll be allowed to go back to work. This has just very slight restriction. The border, inbound border will be open, and the outbound border would be open as well, as long as you're vaccinated, and there will be some travel bubble with some countries. So we will hopefully be able to make some movement. And that is targeted. The way it's going now, the vaccination, and we're expecting by mid-November, inshallah, we would achieve our target 80% vaccination. And hopefully another couple of weeks to get the immune boosting, because if you do have the vaccine today, you take a couple of weeks, 2 to 3 weeks, depending what vaccine you're receiving, to get your full immunity. So by the end of November, that means early December, inshallah, we will see some good, some light at the end of the tunnel, we'll be able to go back to our life. Inshallah, this December, we will enjoy our kids' school holiday as we did a couple of years back. I forgot when was the last time we had a nice school holiday. Now, just the last bit is that a lot of you guys like cheese, isn't it? And this is a Swiss cheese, one of the popular cheese. And this is a nice, scientific kind of picture. What is showing that, yes, if we do have the vaccine, that doesn't mean I'm done and dusted. I don't have to worry. No, COVID, unfortunately, is not giving us much liberty, much room to move around, much room to breathe. We still have to be cautious. We still have to have the social distancing. But hopefully, if you look at this, each layer of this cheese is each intervention. So each physical distancing, mask, hand hygiene, avoid touching your face, avoid crowd, and outdoor, indoor ventilation, keep the doors open, and financial support for government for us to quarantine. And the last nail of this coffin, inshallah, going to be vaccine. If we do have the vaccine, hopefully we would achieve our goal and we'll make it a call the end of this hassle. As we can see, the US and UK, they are pretty much, even though the infection is still happening there, but the number of people dying or getting hospital is much, much less, and hence they're pretty much going back to their normal life. Now, I probably would not talk on this. I think Dr. Shiraj will tell me that you have got enough time. I already spent enough time, but these are the questions that I get encountered.
Please finish this slide.
Okay, so these are the questions I get encountered by by our brothers, and I just briefly talk because you might have the same question. So pregnancy and lactating breastfeeding mother, can they be vaccinated? Okay, so with the current guidelines, pregnancy and lactating mother can be vaccinated. There is no major concern. They are preferably, or probably I would say, they should receive the Pfizer vaccine, not the AstraZeneca. And Australian government is, following that and very generous about that. Anyone pregnant, they would be offered a Pfizer vaccine. It will give the baby hopefully some immunity as well, not only just mom. Okay, vaccination for children. What is the age group? My son just sitting with me here, and he likes to go back to school. And I just tell, look, what is the cutoff? So at this point, Australia is cutoff for age would be 16 for vaccination. However, in America and UK, they started 12 plus to have the vaccine. And inshallah, by the end of the year, before our kids go to school next year, because I don't see they might be going back to school this year, hopefully that younger children would be, year 7 children might be getting the vaccine who turn to be 12 plus. People with the cancer or who are those who got immune suppression, they can they be vaccinated? Can it be harmful? No, they can be vaccinated, no issue whatsoever. The concern would be that vaccine might not give them much immunity because their body is already immune knocked down condition. So even though got vaccine, their immunity might not be, protection might not be 80%. They might get 60%, 50% protection. That's why you might know that already in the US, they started to give those people a booster vaccine after they receive the second dose. People who already have COVID infection, all right? What about those? Do they need vaccine? They already get infection, the natural virus, the living virus. They should have the immunity. Why they should be bothered about the vaccine? Or if you got a chickenpox, do you need chickenpox vaccine? No. You go to look at the lifelong immunity. Unfortunately, once again, COVID keeps our hands pretty much locked. We have not much room to move. COVID infection does not give you lifelong or long-term immunity. The immunity might be 3 to 4 months. Hence, or even up to 6 months, if you got very bad COVID infection, you end up in ICU, that kind of thing. But still, it's not beyond 6 months. Hence, people, even though got COVID infection, they need to be vaccinated. But when you recover COVID infection, we don't like to vaccinate you. We like to get you out of the COVID isolation, which means 14 days, and your infection symptom all resolved, you're back to normal health. Then we would vaccinate you, inshallah. How long the COVID provides immunity? Very good question. But a very important question people ask me. Brother, okay, I get the vaccine. Okay, how long is going to, So look, once again, if the infection doesn't give you long immunity, vaccine will be the same. at this point, we don't have any data that even though you receive 2 shots of AstraZeneca or Pfizer, how long would be? Roughly, it's talking about 6 months, 6 to 12 months. We're waiting for the research data from other countries. However, there is no recommendation or provision of any booster COVID vaccine for Australian population at this point in time. Once you get the second dose done, you are done, alhamdulillah. You wait for the government's recommendation. Hopefully next year, it will be a booster vaccination will be coming. Same like, your influenza vaccine that you have to inject the flu jab every year. Nothing special. Does the vaccine change my DNA or genetic mapping? One question that an audience asked me in the Lebanese Muslim Association community talk that, brother, you are guys injecting mRNA to me and it might goes into my nucleus and it changed my DNA and I might turn to a chicken. And how and what's going to happen? I just, look, it does not go into your nucleus. It does not change your DNA. It goes to your cell outside the nucleus, and it is very fragile vaccine. The mRNA, is very nanoparticle. It gets fragmented and broken down and disappear from a system within a couple of days. And it has no issue whatsoever with your genetic mapping changing or giving you cancer or some sort of complication in the long run, on the ground of the evidence that is available at this point in time. Can I mix up my vaccine? For example, someone take AstraZeneca vaccine and had a reaction, got a skin rash or probably, a blood clot. And then he came to ask me, brother, look, doc, I can't take that. I'm not going to take the AstraZeneca anymore. All right. And that when I assessed him, because I'm a lung physician, so he had blood clot in the lungs, I was convinced it is not the vaccine he got the clot from. It was, he was obese, he got another problem. So there was a good reason for him to blood clot, but he was reluctant to go to the second AstraZeneca. Then when I worked out, so we decided to give him Pfizer as a second dose. So yes, Australia, it is not a common practice that if you got a reaction or some complication, so receive a different vaccine, but yes, your GP is authorized to do that. If any major concern, not just you think it is your issue, if the doctor thinks it is an issue and this patient should not be given, he can tick you off. Okay, AstraZeneca first, that's fine. I'm not going to take AstraZeneca cross, and then you go to that second Pfizer. And your immunity will be still the same. You will get still the same immunity as you get to AstraZeneca or to Pfizer vaccine. Last question, is the vaccine 100% protective? Look, we rely on Allah subhanahu wa ta'ala. At the same time, we hope for the best. And there is nothing as such on this earth that's called 100%. In medicine, we never say never. We don't say the use called never or the word called always. There is always something in between. So there is nothing, it's not 100% protective, but it definitely reduces a substantial proportion of you to be very sick, to be ending up in hospital or going to be ICU or causing death. Alhamdulillah, that was all my talk. Assalamu alaikum wa rahmatullahi wa barakatuh.